new stimulation techniques are becoming increasingly used in many clinical situations. And in the case of the spinal cord, that includes pain management and recovery of function after spinal cord injury. Hi, my name is Anthony Windebank. I'm a neurologist and neuroscientist at the Mayo Clinic, and I'm going to talk a little bit about a paper that's coming out in the Mayo Clinic Proceedings in June of 2021. The title is Segment-Specific Orientation of the Dorsal and Ventral Roots for Precise Therapeutic Targeting of the Human Spinal Cord. The paper was led, and the first author was Dr. Alan Mendez, who was a postdoctoral fellow with our team, who's gone on to additional training now. And hopefully the title explains exactly what the purpose of the paper was. Typically, electrical stimulation is given through the skin or from electrodes placed over the outer lining of the spinal cord. Now, as electrical stimulation becomes more refined in terms of localization, it is essential to know how the position of stimulating electrodes relates to the underlying spinal cord anatomy and the nerve roots. And this is the first detailed study in human cadavers of the relationship between the spinal cord and the nerve root anatomy and the bony landmarks that we can see on X-ray or other imaging studies. So this will lead to us allowing much more precise application of the electrical stimulus to the spinal cord's structures. Anatomy was extremely important in this study, and I will hand you over to my colleague, Dr. Nirusha Lachman, who is Professor of Anatomy here.
Thank you, Dr. Windebank. Again, I am Nirusha Lachman, Professor of Anatomy and Chair of the Department of Clinical Anatomy. As a clinical anatomist at Mayo Clinic, my practice entails partnering with research teams such as the ones led by Dr. Lavrov and Dr. Windebank, as well as physicians to leverage anatomical data through anatomical dissection and imaging. Anatomical data-driven scientific investigations are becoming a key tool in the advancement of clinical procedure and innovation. Our current publication is an excellent example of how we were able to measure and define orientation patterns of the dorsal and ventral nerve roots along spinal cord segments. This information was not previously known, as much of the data that we work with anatomically is actually based on models designed for highlighting only basic understanding of the human body. As we progress into more evolved platform of discovery, this standard one-size-fits-all information is not sufficient. Results from this study not only provide definitive measurements of exit angles, but also demonstrate the importance of having access to human cadaveric models that enable us to answer simple questions that were never previously asked, but today have become indispensable in our efforts to advance the practice.
So I would now like to introduce Dr. Igor Lavrov, who has really been the lead investigator on this team. With his strong background in anatomy and neurophysiology. So Igor, please tell us more details about the publication.
Understanding the spinal cord neuroanatomy is essential for diagnosis and treatment of multiple disorders. The role of specific spinal cord structures in neuromodulation was broadly discussed, but many aspects of spinal cord anatomy are still unknown. In our new study, precise neuroanatomical measurements of the spinal cord were collected, analyzed, and correlated. These results are critical for future development of stereotactic procedures, neuromodulation approaches, and spinal surgeries. I am Igor Lavrov. I am an assistant professor at Neurology Department at Mayo Clinic, Rochester. In our previous work, the spinal cord neuroanatomy was precisely correlated with the magnitude of motor evoked potentials during epidural electrical stimulation. Specifically, we found that proximity of stimulating electrode to the dorsal roots across multiple segments was a critical factor to evoke high motor responses. These findings demonstrated the influence of the spinal cord anatomy on the effect of epidural stimulation that is commonly used to control pain. They also emphasize the role of specific position and orientation of the electrodes. Because of multiple aspects of spinal cord anatomy are still unknown for human, in our new study published at Mayo Clinic Procedures, we collected measurements of the spinal cord roots and spinal cord overall on cadavers. This work, for the first time, provides precise description of the dorsal and ventral roots orientation along the main spinal cord measurements and the segment-specific orientation at the cervical, thoracic, and lumbar segments. We also collected information on variation in number of rootlets and other spinal measurements and demonstrate the strongest correlation between the length of intervertebral foramen, rostral rootlet, and vertebral bone length. This study was only possible because of strong collaborative environment at the Mayo Clinic and highly productive collaboration with Dr. Lachman and Dr. Widdebank's teams. As spinal cord neuromodulation therapy continues to evolve, with novel approaches translated to the clinical practice, these results will be important to precisely locate spinal cord structures for stimulation of surgical procedures. They are critical for treatment of multiple conditions, including chronic pain, spasticity, and spinal cord injury. These results will help to improve electrode positioning for spinal cord neuromodulation and also design segment-specific electrodes to cover specific targets to treat pain or restore functions after spinal cord injury. This work also may lead to better understanding of the functional neuroanatomy of the spinal cord. Please read our paper, and we hope that it will help in your work and it will help patients. Thank you.
Thank you, both Igor and Narusha and the whole team. As Dr. Lavrov said, this is a team and collaboration effort across different disciplines. And we hope that you'll be able to read the article in the Mayo Clinic Proceedings and that it will benefit your work, whether it's in patient care or electrode design or any aspect of moving this field forward for the benefit of patients.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.